This is Dr. Smith. He's been a physician for over 10 years. After finishing medical school, Dr. Smith was excited to open his own practice, develop meaningful relationships with his patients, and help them manage their health needs in a manner which allowed them to live their lives to the fullest. Soon after his practice opened, Dr. Smith discovered there were many obstacles in traditional healthcare models, which prevented him from developing the type of doctor-patient relationship necessary to deliver the highest level of primary care. Spending just under 10 minutes with each patient per visit was not enough time to get to know his patients well, much less understand their full healthcare needs or develop plans to prevent future health problems. In addition, he typically only saw his patients after they became sick, so there was a lot of reactive care, but not a lot of preventive care. Dr. Smith wanted to make healthcare decisions with his patients, but often found the interest of insurance providers and government in the middle of those decisions. He found himself working long hours, missing time with his family, and skipping lunch, which disrupted his own well-being. He was disturbed that his patients were paying an extraordinary amount of money for their healthcare coverage without receiving the best return on investment. Not to mention, Dr. Smith was forced to hire administrative staff for the sole purpose of filing insurance, increasing his practice's overhead dramatically. Dr. Smith knew there had to be a better way to build effective doctor-patient relationships, reduce costs for patients and his practice, and keep insurance companies and the government from getting in the way of the medical needs of his patients. Dr. Smith did some research and discovered an innovative healthcare model called direct primary care, or DPC. He was delighted to see that DPC solved many of the problems his practice was facing. And here's how. DPC provides physicians the time to develop effective doctor-patient relationships. DPC doctors see fewer patients per day and spend an average of 35 minutes per patient per visit. DPC doctors use that time to get to know their patients and their health issues deeply, which helps them diagnose and treat their patients with greater long-term success. DPC has a unique payment system which avoids processing insurance and Medicare altogether. With DPC, patients make an affordable monthly payment directly to the physician, like a gym membership, and pay a nominal fee per visit to the doctor, depending on the service provided. This structure makes DPC accessible and affordable to everyone, regardless of their financial status. Patients are encouraged to maintain a catastrophic high-deductible insurance plan. If that plan provides minimal essential coverage, or MEC, it can be combined with DPC coverage to meet the full ACA requirements to avoid penalties in 2018. Because DPC practices are not bogged down with the administrative costs and demands of traditional insurance companies, their overhead is drastically reduced. Ultimately, they can spend their time and their money offering specialized customer service and higher quality patient care. Many DPC physicians leverage modern technology to connect with their member patients at any time via text, email, or phone, as an example of this specialized customer service. Spending more quality time with a direct primary care physician means patients will spend less time in the care of specialists and may avoid unnecessary hospital or ER visits. However, if a visit to a specialist or hospital is necessary, DPC practices assist in finding the most cost-effective options. Dr. Smith has now switched his practice's healthcare model to DPC and has more time for his patients, his family, and himself. He is able to do exactly what he has always wanted to do as a physician: develop meaningful doctor-patient relationships and provide affordable, high-quality healthcare to the people in his community.